Hi. Babies often go a long time between bowel movements. Most of the time it is normal for a baby to go days or even more than a week without a bowel movement. However, a baby may sometimes be constipated and need a little help. If a baby is constipated, the pediatrician may recommend using home remedies as a first-line treatment for baby constipation. 1. Exercise. As with adults, exercise and movement tend to stimulate a baby's bowels. However, as babies may not be walking or even crawling yet, you may want to help them exercise to relieve constipation. You can gently move the baby's legs while they are lying on their back to mimic the motion of riding a bicycle. Doing this may help the bowels function and relieve constipation. 2. A warm bath. Giving a baby a warm bath can relax their abdominal muscles and help them stop straining. It can also relieve some of the discomfort relating to constipation. 3. Dietary changes. Certain dietary changes may help constipation, but these will vary depending on the baby's age and diet. While breastfeeding a baby, you could eliminate certain foods, such as dairy, from your diet. It may take some trial and error to identify the dietary changes that help, and it is quite possible that changes in the diet will have no effect on the baby's constipation. For formula-fed babies, you may try a different kind of formula. It is best not to switch to a gentle or dairy-free formula without consulting a pediatrician first. If one change does not make a difference, continuing to try different formulas is unlikely to help. If an infant is eating solid foods, you should look to introduce foods that are good sources of fiber. Good food choices for babies with constipation include skinless apples, broccoli, whole grains, such as oatmeal or whole grain bread or pasta, peaches, pears, plums, tomatoes. 4. Hydration. Young infants do not typically need supplemental liquids as they get their hydration from breast milk or formula. However, babies that are constipated may benefit from a small amount of extra liquid. Pediatricians sometimes recommend adding a small amount of water or, occasionally, fruit juice to the baby's diet when they are over 2 to 4 months old and are constipated. 5. Massage. There are several ways to massage a baby's stomach to relieve constipation. These include using the fingertip to make circular motions on the stomach in a clockwise pattern, walking the fingers around the navel in a clockwise pattern, holding the baby's knees and feet together and gently pushing the feet toward the belly, stroking from the rib cage down past the belly button with the edge of a finger. 6. Fruit juice. A small amount of pure apple juice can help soften stool. After a baby reaches 2 to 4 months of age, they can have a small amount of fruit juice, such as 100% prune or apple juice. This juice may help treat constipation. Experts recommend starting with about 2 to 4 ounces of fruit juice. The sugar in the juice is hard to digest. As a result, more liquid enters the intestines, which helps soften and break up the stool. However, you should not give fruit juice to a baby for the first time without consulting their pediatrician. 7. Taking a rectal temperature. When a baby is constipated, taking the baby's rectal temperature with a clean, lubricated thermometer may help them pass stool. It is important not to use this method very often, as it can make constipation worse. The baby may start not wanting to pass a bowel movement without help, or they may begin to associate having a bowel movement with discomfort, leading them to fuss or cry more during the process. Anyone who feels as though they often need to use this method to help the baby have a bowel movement should talk to the baby's doctor. If you have any other tips, please leave them in the comments section below, and don't forget to subscribe to our channel for more videos like this. Thanks for watching.